Most of the couples, when they try, they do not know what are the fertile days. Fertile days means when the egg is formed. The life of the egg is only 24 hours. And if you happen to have intercourse during those 24 hours, then only you can conceive. So the fertile days in 1 month are hardly 2 to 3 days. So it is important for the couple to know which are their fertile days. For the best knowledge about the fertile days, they should consult their gynecologist, and it is very easy to know what are the fertile days. First of all, the temperature during the fertile days is raised by 1.1 to 0.2 degree Fahrenheit. Second is the vaginal mucosa becomes slightly thinner and more mucoid. So if you put a finger in your vagina, the mucous secretion will be slightly watery and it will be creating a sort of tar, जिसको आप कह सकते हैं. The mucoid discharge will be thin and watery so that it can attract and it can help in motion of the sperms. And thirdly, in case you happen to do your ovulation test with the help of your urine, putting just 3 drops on the ovulation kit, and it shows one line of the test that is darker and the other line should also be darker, that is controlled should also be darker. That shows that your fertile period has started and now you can go ahead with the intercourse for another 2 to 3 and there are high chances of conception. Moreover, if you notice that there is a pain in the mid-cycle on either of the sides of the uterus, so on the right or the left iliac fossa in the lower abdomen, if you feel pain and slight bloatedness is there and that subsides within say 5 to 6 hours after the rupture of the egg, then it is all the more good indicator of ovulation. So in case you can notice all these 4 features, you will be able to conceive. But in case none of them you cannot notice any of the features and you are not able to conceive in spite of these measures, then you should go to the doctor and get your ultrasound done. That should be started from the 8th day or the 10th day of your cycle, and maybe you have to undergo 2 to 3 ultrasounds to know what is the size of your follicle and what is the endometrium, and then your doctor will tell you when to have intercourse. That is what is your fertile period. Once you have known your fertile period, that can be used in next cycles also in case you don't conceive in this cycle. So if your sperm count, your sperm motility is normal then, and moreover your ovulation is normal, your periods are regular, and you know the fertile days, with this knowledge only you can conceive. 70% of the women conceive with this little knowledge of ovulation.